Hello everyone, myself Mahakash Rakshit. I'm a second year of MBBS student from NILRATAN SIRCAR Medical College and Hospital. Today we will be discussing about femoral sheath, a very important topic from infex. Femoral sheath is actually a funnel-shaped prolongation of fascia around the upper 3 to 4 centimeter of the femoral blood vessels, that is femoral vein and femoral artery, and it blends with the tunica adventitia of the blood vessels. Now let's look how this is formed. If we go to see the anterior abdominal wall, we will get to see three muscle layers. That is, this is the anterior abdominal wall, external oblique, then we will get to see internal oblique, and then we will see transversus abdominis, and just below it we will get to see a fascia which is called fascia transversalis, right? And if we get to see the posterior abdominal wall, we will get to see iliacus muscle which is covered by fossa iliaca. These fossas elongations form actually the femoral sheath. Femoral sheath's anterior wall is formed by fossa transversalis and the posterior wall is formed by the prolongation of the fossa iliaca, and ultimately the upper 3 to 4 centimeter of the femoral blood vessels are covered by this fascia, and ultimately it blends with the tunica adventitia of these blood vessels. This femoral sheath is actually not symmetrical. Its lateral part is vertical, whereas the medial border is somewhat oblique, and it is oblique laterally, right? This femoral sheath is compartmentalized into three compartments by two antero-posterior septa. Right? Here are these two antero-posterior septa. The lateral compartment, and this one is the lateral compartment, this is the intermediate compartment, and this is the medial compartment. The lateral compartment contains femoral artery along with one nerve. Yeah, this one is my femoral branch of the genitofemoral nerve. The intermediate compartment contains femoral vein, and the medial compartment, also called the femoral canal, contains some fibrofatty tissue and the deep inguinal lymph nodes, also called lymph node of Rosenmuller or lymph node of Cloquet, right? If we get to see a transverse section here, this is the lateral side and this is the medial side. The lateral compartment contains the femoral artery and femoral branch of the genitofemoral nerve. The intermediate compartment, that is this one, contains the femoral vein, this one, and the medial compartment, also called femoral canal. Here we are getting to see the femoral ring. This contains, femoral canal contains deep inguinal lymph node or lymph node of Rosenmuller, right? And this femoral canal or medial compartment of the femoral sheath is a potential site for the formation of the femoral hernia. That is, when the intestinal loop comes inside this femoral canal, we call it femoral hernia, which is more common in female as they have wider pelvis and the femoral ring is more wider for them, right? Let's look some diagrams. Here is a very beautiful diagram of a femoral sheath. Here this is the posterior wall of the femoral sheath, which is actually prolongation of the fascia iliaca. This is the anterior wall of the femoral sheath, which is actually elongation of the fascia transversalis, and here are two antero-posterior septa which compartmentalize this femoral sheath into lateral, intermediate and medial compartment. This is the lateral, this is the medial, and this lateral compartment contains femoral artery and femoral branch of the genitofemoral nerve. The intermediate compartment contains the femoral vein, this one, and the medial compartment, or called the femoral canal, contains deep inguinal lymph nodes or lymph node of Cloquet or Rosenmuller, right? So this is all about the must know regions of the femoral sheath, which you must know, and I think this is more than enough to study prior to examination of anatomy, right? So let's finish it right now. Stay happy, stay healthy, take care, and for more some such interesting short and compact videos of anatomy, Do subscribe our channel, and if you like the video, hit the like button and don't forget to share with your friends, right? Okay, tata, bye bye.